Hi, beautiful people. It's me, Dr. Roll. Today, I am talking about coronavirus disease 2019, and this is going to be a question and answer video. So, before that, I do want to go over some basics. The basic first question is, what is coronavirus anyway? It is a member of the coronavirus family, which means that it is a virus and it usually causes the common cold. The family of coronaviruses, it usually causes the common cold, and that's something that many of us have had several times and gotten over season to season. The difference between the novel coronavirus disease 2019 is that, as with any virus, there's mutations that happen. So this coronavirus, also being called COVID-19, is not the same as the ones that cause the common cold because it has mutated in a way that it is causing a severe acute respiratory syndrome. I'm just going to be looking at my notes just to cover some basics first. How is it spread? So it's spread by droplets, meaning that if someone coughs on you or sneezes on you, or you cough into your hand, those droplets now contain the virus, and it's spread by you touch a door, or like I said, you sneezed on someone, you coughed on someone, you touch any object, and now the virus has been transferred to that area. This is why we have been saying it's so important to wash your hands with soap and water, wash for 20 seconds at least, to continue to cleanse your hands of the virus. That dramatically reduces the transfer of the virus because you've now cleansed the surface of your hands. That's another reason that we're telling you to cleanse frequently touched objects, because like I said, if you're coughing into your hand, the virus is now on your hand. You now go and touch something like a door handle, you've now put the virus on the door handle. Even if we're just talking about within your home, you have door handles to your bathroom, you have door handles to the front door, you have the refrigerator door. These are things that you are constantly touching. And if you have symptoms of cough or fever, you might as well just put yourself in the category of you have coronavirus disease. Now, I know that I live here in Broward County, Florida. I know that some areas like New York and other places have seen much more of COVID-19 in terms of people being extremely sick and the number of people being extremely sick. You personally may have not seen anyone sick with these type of symptoms or with shortness of breath or in the ICU, fighting for their lives, but you might as well just go ahead and act like you have COVID-19, okay? That's the only way that we're going to reduce the number of infected individuals, because if you act like you have COVID-19, you are going to protect your family, protect your friends. You're not going to go out and infect other people that are your loved ones. And that's why I'm saying just act like you have it, okay? It's better to be safe than sorry when it comes down to this disease, because at this point, even though other countries were originally reporting that the majority of the people who were becoming very ill and dying from COVID-19 were the elderly, were the immunocompromised, were people with severe comorbidities or already had lung disease, lung cancer, COPD, asthma, things like that. In the elderly, I'm talking like 80 and above, okay? That is not the case in the US right now. Yes, elderly, people with comorbidities, people who are immunocompromised are being affected at greater numbers just because they don't have that reserve that younger people have. However, we have also been seeing in this country that younger people are becoming very sick and dying from this illness. Young, healthy people too. And when I say young, I'm not talking about the 65-year-old, because I consider 65-year-olds young in the healthcare professional industry world. I feel like 65-year-olds are young. That's not who I'm talking about. I'm talking about people in their 30s, people in their 40s, people in their 50s, okay, who are healthy with no medical problems, are dying from COVID-19, okay? That is why we're telling you, back to the thing, how is this spread? That is why we're telling you to stay home. Some people are not taking it serious. We've already told you that you don't have to have symptoms to have COVID-19. And that's why we're telling you to stay home, because you here, and I just want to take the time out to thank everyone. There are many people who are taking this very seriously, whether they know someone in the healthcare field or not. There are people who are taking this advice very seriously, and they are protecting themselves. They're washing their hands. They're staying home. They're self-quarantining if they do have cough or fever. And I just want to take the time out to thank you all who are taking this advice, because it's very serious. Like I said, you can have no symptoms at all and be carrying around coronavirus. You're going around infecting other people, whether they be healthy or whether they be sick or immunocompromised. Right now, we don't exactly know why it is that some of the young people who are healthy with no medical problems are dying from this illness. So like I said, you may not know anyone personally who's had to be intubated, put on the ventilator, or died from this illness, but we're just trying to tell you, just take it seriously, because if we as a people in this country continue to just laugh this off or ignore this or whatever you want to call it, we continue as a country to act like it's not a big deal and go around spreading this to other people, we're going to have a lot more unnecessary deaths in this country. So I just want to go over this again. Here, things that you can do to prevent. Number one, right here, stay home when you're sick. And right now, I'm telling you, stay home even if you're not sick. Because right now, even though I just said, act like you have COVID-19, you may not have COVID-19, but guess what? You might have gone to some random store that you didn't need to be at, where somebody else who had COVID-19 just came out of that store. And now you've infected yourself. Okay, like I said, we don't exactly know right now why it is that some young healthy people are getting very sick from this disease and are dying from this disease. So you don't need to unnecessarily infect yourself, is what I'm saying. That's why we're saying right here, stay home. Number one, this isn't obvious. Avoid contact with sick people. That's a no-brainer. This part right here, take care of yourself. Get adequate sleep and well-balanced meals. That's very important, because you need to give your body all the support that you can get, and that includes staying hydrated, drinking an adequate amount of water, and that includes eating healthy, okay? Whether you have diabetes, high blood pressure, whatever, you could be as healthy as you have nothing whatsoever. Okay, I recommend eating healthy, eating vegetables, eating fruits, trying to get rid of eating all this processed food and sugar, but that's another story. But here, get adequate sleep and eat a balanced diet. Again, we've already said this multiple times. Wash your hands often for 20 seconds. Dry your hands. Avoid touching your face. That's a very difficult one to do because the minute somebody tells you to stop touching your face, that's exactly when your face starts itching and you're all in here scratching your nose, itching your face, scratching your face. Here we have cover your mouth with a tissue whenever you're coughing and sneezing. That again goes to avoiding the spread of the droplet infection, infection particles of coronavirus. So we have a question from Hattie Asbury. Hi. What are the symptoms to look for other than mucus and fever? So we've seen people, they're basically saying cough, fever, and shortness of breath are the main symptoms of coronavirus. Some people have been reporting sore throat, dry cough. Some people have had diarrhea. But again, the symptoms are varied, okay? You can be anywhere from 0 symptoms walking around with coronavirus. Again, that goes back to the whole stay home because you don't have to have symptoms to have coronavirus. But yes, the symptoms are generally fever, cough, shortness of breath. Obviously, if you have shortness of breath and you cannot breathe, go to the ER, call 911. If you can breathe and you have cough and fever, stay out of the ER. Please stay out of the ER. Please, please, please stay out of the ER. Stay home. Just self-quarantine if you have cough and fever, if you have sore throat and fever, if you have fever and diarrhea. If you have any kind of fever, just stay home. Self-quarantine for 14 days. That's the best way to go about this. Like I already said, clean and disinfect things and call your doctor before visiting, okay? We're trying to decrease the amount of contact between people in general, people and people to their doctor. We're trying to decrease contact by any means necessary, okay? Now, let me look over here to see if anyone else had any specific questions. I know that your next question, what's the best fever meds? Oh, that's actually a good question. I am a big ibuprofen, Motrin type of person, Advil. They are recommending no, do not, please stay away from any type of NSAIDs, ibuprofen, Advil, Aleve, naproxen. Stay away from those. Stick to Tylenol, okay? You can take 325 Tylenol or 650 Tylenol every 4 hours as needed for your fever and pain, but try to stay away from Motrin, ibuprofen, and any type of NSAID medication, okay? Another question that people have concerns testing and screening. Like I mentioned before, most of the symptoms for COVID-19 include fever, cough, and shortness of breath. In order to be tested for COVID-19, you do have to have a prescription from your doctor. So you either can call your own doctor and try to get a prescription for COVID-19 testing, or you can call or virtual visit with a telemedicine provider such as Rodox. That's ROWE docs, DOCS, or your own doctor if they're providing telemedicine. You can get a prescription from them for the COVID-19 testing. Now, you have to be symptomatic. In order to screen for the testing, you do have to have fever, cough, or shortness of breath. They do have multiple testing centers where they are providing tested for COVID, but like I said, you need a prescription first and you need to be symptomatic. As they increase testing, they may decrease some of these criteria, but as it stands now, If you do not have fever, cough, or shortness of breath, you are not being tested. I can only speak for my ER, but we're not going to test you in my ER if you have no symptoms, or if you're not being admitted. And most of these outpatient testing centers, if you do not have fever and cough and a prescription from your doctor, they are not going to test you. In terms of other information, I will be posting information on my page about numbers that you can call for more questions, COVID-19 hotlines. I'm going to scroll back through the list one more time to see if I missed any questions. Hi, Derek. I just want to say right now, thanks for everyone who joined. I see a lot of people here, people I went to school with. Thanks for joining, everyone. Again, if you have questions, don't hesitate to post them on my Facebook page. You can post it on my personal page, or you can post it on my professional page at, it's under, if you search A-Roll MD, or even if you look on my personal Facebook page, there's a link at the bottom for my professional site. Let me just scroll back through here. So take-home points are: stay home, wash your hands, try to take Tylenol for fever and pain, avoid ibuprofen, call your doctor or telemedicine provider if you need to be tested because you have cough and fever. Someone asked, Bridget Gordon asked, is it safe to go paddle boarding at the beach? No. I'm just gonna say anything that involves you being outside where other people are. I mean, I'm pretty sure a lot of things have been shut down, but don't go to the beach. Don't go anywhere where someone else may be. Okay, I know this whole keep your 6 feet of distance. That's a good distance to keep yourself. If you need to be outside where other people are going to be, do not be closer than 6 feet to anyone else. And again, don't go anywhere where other people may be. Those are all of the recommendations I have for you. Again, like I said, I wanted to say a big thank you to you who are taking the advice, who are staying home, who are not doing any unnecessary outings. I don't care if there are 10 people or less. I'm just saying, if you're not, thank you for not doing unnecessary outings. Some things you can't get around, I do understand. Just try to keep your distance 6 feet. But I do want to say a huge thank you, and I just want to emphasize again that this thing is serious. Florida, we are only at the beginning. Personally, at my hospital, we have started to see patients who are dying from this illness, and we are just at the beginning, Florida. New York is pretty much at capacity, okay? All of their ICUs are only COVID positive patients in severe respiratory failure. And we're not even there yet. Obviously, I don't want us to get there, but if people do not take the whole, let me try not to spread this to someone else. You know, if people don't try to take on personal responsibility for this pandemic, Florida is about to be the next New York. And I'm really not wanting that to happen. That's why I'm getting on here. That's why I'm spreading the news. That's why I'm spreading out information, ways to continue to protect yourself, your family, and being here as support as well for you all. So I see another question. If you are practicing, hi Jessica, if you are practicing social distancing but live with someone that is an essential worker, how can they minimize the risk of bringing the illness to the family? Uh, and there goes me touching the face. But I washed my hands before I started this video. Um, so that's a good question. Like I said, we need to stop spreading. We need to stop being in contact with people. Some people cannot afford to do that in terms of their job is just, for whatever reason, not shut down yet. I feel that in addition to the trying to keep 6 feet distance from people, um, wear a mask, you know, wear a mask. Um, the gloves are not going to help you too. I want to say that people, again, I wash my hands already. People are out here wearing gloves to wherever they're going. The gloves aren't going to help you if you are wearing them all day. You're touching all these surfaces and then you're touching all your stuff. You're not disinfecting your stuff. The idea of the glove is to keep a barrier between you and that dirty surface that someone else has put coronavirus on. But if you're wearing these gloves all day and you're touching all your stuff and you're not disinfecting all your stuff, you're just putting that dirty corona that you have on your gloves on all your stuff. Okay, so gloves are meant to, if you're gonna wear them to do a specific thing, and then you're gonna take them off and wash your hands still, that's when the gloves are gonna help you. But you wearing one set of gloves all day long as you go to this store and to that store and touch this basket and that shopping cart and this whatever, you might as well think around, you walking around with corona all over your gloves, okay? And I'm hoping you didn't touch any part of your face, any part of your body, any part of your, steering wheel and all that stuff that you're gonna go back and touch with your bare hands. So just remember, disinfect everything that you can, and that'll help you out to decrease the spread of germs. So, Winsome, for compounding pharmacy, what did they say about ibuprofen? So it gets really technical here, but just to answer your question, Winsome, it has to do with the ACE cycle. Let me see if I can find it right here. But it basically has to do with how the virus binds. They're saying that potentially the ACE, the ibuprofen, is linked in that way. Let me see if I can quickly pull it up without taking too much time off of here. I'm not seeing it really quick, but basically it does have to do with the way that the virus binds and the fact that it uses the ACE. Yeah, I'm not seeing it right now, but I'll get back to you on that. I'll get back to you on that whenever I find it. Yeah. So, hi Veronica, thanks for joining. If you have any specific questions for me, oh, here's another question. Hi Sonia, how can you know? How can you know? I mean, being in the home with kids, washing hands, covering sneezing and coughs, etc., quarantine, how can we prevent spreading in the home? Like if we go to the mailbox, airborne. Okay, so there are some things that we know causes the virus to aerosolize and become airborne, and that has to do with nebulizer treatments and also MDI inhalers like albuterol. as we know for right now, it's mostly spread by droplets. So things like the mailbox, that's a time where you can wear gloves. And then, like I said, once you deal with everything, take the gloves off, wash your hands. Or you can just, if it's like a mailbox that's right outside your home, you can disinfect the mailbox and get the mail. But then, the mail is technically contaminated, the mail itself. But you can wear gloves to go through your mail, and then take off the gloves and wash your hands after that. But in terms of the other part that you're talking about with quarantining, washing your hands and disinfecting everything, those are all the things that we're recommending. So you're good with that. We're telling everyone who has symptoms to quarantine yourself for 14 days, and try to decrease the amount of contact with other people and disinfect everything in your home. But also, that includes, like, once your symptoms are gone, you don't want to say, oh, yay, today is the first day I don't have cough and fever, I'm going to go out, or I'm going to stop quarantining myself. You still want to give about a week at least after you have no symptoms, before you start just interacting how you were prior to onset of symptoms. Hi, Sam. Hi, Angel. Thanks for joining. So yes, those are the things that we know. Like I said, in terms of becoming airborne, that's when you use things like nebulizers. Like those of you who have asthma, the nebulizers do seem to make it airborne, and also the albuterol inhalers. So be careful with those things. So hi, Crystal. Yes, dry cough means that you're not producing mucus or bringing up anything when you cough. Yes, that's correct. I was just looking down to see if I could find the NSAID information again. So Winsome, if you're still there, it's saying that the use of non-steroidal anti-inflammatory drugs, those are NSAIDs for those of you who don't know, things like ibuprofen, Advil, Motrin, Aleve, naproxen. It says that it's raised concerns because of the postulated interactions with the SARS coronavirus 2 binding to the ACE2 receptors. They're saying that there's no scientific evidence to suggest that taking NSAIDs worsens COVID, but people have seen in practice that the people who were getting Motrin or ibuprofen or NSAIDs seem to do worse than those who weren't getting them. So that's why we're recommending to stay away from the NSAIDs. Hi, Cynthia. Hi, Annette. Thanks for joining. So, yes, like I said, again, Florida, we are only at the Hi, Dad. Sorry, guys. Hi, Dad. Thanks for joining. So, yes, again, if you're just joining this live, I thank you for joining, first of all. Hi, Veronica. She's asking, as long as I practice social distancing, is it okay for me to continue my evening run? Yes, it is okay. Now, we are not saying, lock yourself inside your house for the next 14 days. Now, if you have symptoms, I mean, you still can go outside of your house, but we're saying to try to avoid people. Try not to be 6 feet near someone else. So yes, going for an evening run is fine. as long as you are not coming into contact with people. Like I said, the spread is droplet, meaning sneezing, coughing, physically putting the coronavirus on someone else or on to a surface object. So if you have no symptoms and you're running, even if you pass by someone else on your evening run, if you're not anywhere in their space and they're not in your space, and you guys are not coughing and sneezing on each other, then theoretically you should be fine. Like I said, theoretically, because we can't really prove one way or another, except for that you don't get any symptoms and you never become ill. So these are just recommendations. But again, yes, you can go on your evening run and you should be fine. Hi, Lily. So yes, what I was going to say again, hi, Cody. Again, I'm only speaking for myself and this area in Broward County and what we have seen so far. We are starting to see an increase in people who are in severe acute respiratory failure. Some of these people have not had symptoms for a week or so, okay? It's more like 4 days, 5 days, and then they're getting into trouble. You, like I said, may not have seen it personally, but again, that's because I believe Florida, as a state, we are at the beginning of this. Now, I'm not sure if that means that we're doing such a great job. Hi, Stacy. Yes, from droplets, like cough or sneeze. I'm not sure if, because we're doing such a great job at social distancing, we are really decreasing the number of people who are going to get this. That could potentially be why. But at the same time, I have a fear that it's just because we are at the beginning, and a lot of the people who have not shown up to the ER in severe respiratory distress is just because their onset of symptoms have not started yet. We know that people who are asymptomatic from coronavirus can be asymptomatic for up to 8 days, no symptoms whatsoever. And then, they start to have cough and fever. Now, a good majority of people who end up getting coronavirus will get over this just fine and go back to their normal life and be done with coronavirus for this season. But a lot of people are going to end up being extremely sick, ending up in the ICU on a ventilator. So we have a question here. Okay, I have sarcoidosis, and because I don't have a mask, I stay in the house. What else should I be doing? So that is a good start, staying in the house. People who have some type of comorbidity or illness or immunocompromised or lung disease, if you are staying at home, I would recommend you get really strict about your visitors to your house, because again, you don't know if they could be, getting the virus and then giving it to you. So I would just be really strict about people you let in your house during this outbreak. I mean, if they can have a mask whenever they're, coming into your home, just make sure you disinfect anything they touch, and you stay 6 feet away from them. That would be a good start. Hi, Latoya. Question is, what's the treatment for COVID-19 patients? How long does the treatment last? So there's no cure for COVID-19. The treatments that are being used are medications to try to inhibit the viral activity in terms of the way that the virus gets into the cell, the way that the virus operates is trying to inhibit those functions of the virus. Other medications that are being used are to decrease the amount of what we call cytokine storm, basically the natural inflammatory response from your own body, trying to protect itself, trying to get rid of the virus, but it's like an overdrive. And so your body is basically in an inflammatory storm, which then causes multi-organ failure. The other treatments that are being used to target that response and pretty much dampen it to the point that you're not getting so much of a cytokine storm or an inflammatory reaction, so that your body doesn't then go into multi-organ failure. I think I may have missed a question over here, so let me just go look. So Sam asked, with all the research you've done, do you think people become immune after infected, or do you believe we can become reinfected? That is a great question. So on the positive side, up in New York, actually, they are requesting those who have coronavirus and have gotten over it, they're symptom free now, they're actually requesting that they come in for plasma pheresis, because anytime you get sick from something like a virus or anything, your body creates antibodies. And what they're trying to do now is they're trying to use these antibodies to help these severe patients. So they're trying to get plasma from people in order to treat. Now, again, this is like a theoretical thing. It should work, so that's why they're trying to do it. The only problem is not with that approach. The problem with, like you said, can I be reinfected? These viruses can mutate. So we don't know yet in terms of if you're exposed to COVID-19 again, are you gonna get sicker? Or can you get sicker? Are your antibodies enough to handle that reinfection? Or are you gonna, have a huge cytokine storm and end up with ARDS? For those of you who don't know, acute respiratory distress syndrome. It's just not enough information out there. We're trying to learn from the other countries who, unfortunately, they have dealt with so much loss from this virus. We're trying to learn from what has happened there. But we just don't know is the true answer. We just don't know. Are these people immune, or are they getting sicker? There's just not enough information out there, to be honest. Yes. So again, like I said, we're at the very beginning of this. Please continue your social distancing. Please stay home. Please wash your hands. Please disinfect things. Please take this very seriously, because we're only just beginning to see people die from this. And it is very concerning as a healthcare provider. First of all, I'm concerned. I'm worried about my colleagues, the staff at my hospital. I'm worried that, the more people do not take this seriously, the more people are going to be sick. Okay. And it's not just that I'm concerned about my coworkers and the staff at my hospital and my family and friends. I'm concerned about all of you out there, because, it's not every man for himself or herself. It is about all of us. And that's the thing that we are trying to get into everyone's heads. It's not every man or woman for him or herself. it is us as a country. If we do not all take the personal responsibility for this outbreak, it's going to be much worse. And that is my concern, and that is my fear. I do not want to see people die who do not need to be dying. I mean, you know what I mean. Unnecessary. So I just want to say, please continue to take care of yourself. Thank you for joining me in this live. I hope that this information has helped someone. I hope, I'm not trying to scare you. I'm just trying to give you the facts that this is not a joke. This is real. This is happening. People are dying from this. People in your own backyard are dying from this. People in Broward County are dying from this. Please, 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 please take care of yourself. Protect yourself, protect your family. And thank you for joining. Please send me any questions in my inbox, in my professional page, in my personal page, whatever the case may be. I'm here for you. Thanks for being here for me, and I really appreciate it. I hope you really appreciate me taking the time out to just give you information and kind of give you the updates on where we stand. I really, 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 really hope and have faith and know in my heart that we can make it through this as a people if we just together as a family, march forward with this, with, some real togetherness and some real purpose, and stay strong, all of that good stuff. So thanks again for joining me, and I hope you have a blessed day and stay healthy. Bye.